Hey guys, and welcome back to my channel. I'm Benedict, and today's video we're going to be doing a how to prepare for your Ospe tests and exams. Alright, so depending on where you study, you can be referred to as Ospes, SPE, or even your Osce tests or exams. I know I'm going to be referring to them as Ospes because that's just what we call them at Wits University, but bear in mind that they're all pretty much the same thing. So I really hope that you stick around and enjoy the rest of today's video. Okay, so firstly, what exactly is an Ospe? So the Ospe is a practical test that you're going to do in first year and in second year. And basically what happens is that you have different stations. So for the test, you would have 3 stations, and then for an exam, you would have 6 different stations. At each station, you have 5 minutes to perform a specific skill that they're going to ask you to perform. Okay, so after you perform the skill the first station, then you switch to the second station, third station, and if it's an exam situation, then obviously you do all 6 stations. Now at each station you can have they could ask you to perform a certain skill, like maybe measure muscle length or measure range of motion, and you have 5 minutes to do the whole thing. The tricky thing about Ospes is that you have so much of work that you're meant to study, but they can only test you on a couple of things. So now I know that sometimes you tend to feel overwhelmed and be like, oh my gosh, I have to study so many things. How do I tackle this? How do I know what to do? Especially if it's new to you, you've never done an Ospe before, then it's quite difficult to figure out how exactly to approach preparing for an Ospe, and that's exactly what I'm going to be covering in today's video. Now the first thing that I recommend that you do when you're preparing for your Ospe test or your Ospe exam is that you need to write down and make a list of every single topic that you could possibly be tested on. After you make your list of everything that you need to cover, you're going to rate them and decide which of those topics you're struggling with more and which of them you feel more comfortable in. And obviously in whatever topic you're struggling in more, you're going to try to spend more time in that topic. So step 1 is going to be make a list of everything that you need to study and rate them and decide which ones you're going to spend more time on, because most of the time when you're preparing for tests, you don't exactly have the most amounts of time. So you need to make sure that you're preparing a little bit more for the ones that you're really struggling in. The second step in preparing for your Ospe practical is that you need to make sure that you go over all of the theory work and all of the lecture stuff. You need to revise all of those things, and you need to know it well enough that you're able to teach somebody what you know. So you're going to maybe go to a sibling or friend, or go and stand in front of the mirror if you don't stay with anybody, and you're going to literally repeat everything that you know about a certain topic without looking at your notes. That is one of the best ways to teach yourself something, is by teaching somebody else. That's how you learn more. Another thing I want to stress is that when you're going through your theory notes, put more emphasis on your precautions and your contraindications. I know that during the Ospes, those are some of the most important things that you need to mention during the practicals, and sometimes they even give you like a 40% if you don't mention any precautions or contraindications, or if you don't know them. So make sure that you know your precautions and your contraindications, and make sure you say them before you actually start even touching your patient. Something else to add under revising the theory content, you want to do this also because usually at the end of the Ospes they like to ask you some questions, and that question can be based on anything in that skill or in that topic that you're doing. So knowing your theory content will also help you when it comes to answering those questions, which contributes to your Ospe test mark in total. The next thing that you want to do is make sure that you practice as much as possible, and practice on an actual human being. Don't just go over the technique in your head, because your exam is practical. You're going to have an actual human being, so that's how you need to practice. So you're going to try and link up with a friend, or if you have a sibling that you can practice on, that's even better, but make sure that you're going over all your technique and all of your skills on a human being, and that you know how to do all of those things. So if you find that you're not really sure how to do a technique, or you've forgotten how to do them, because I know that sometimes they teach you things months ago and they expect you to do the practical exam and you've already forgotten what they taught you back then, a nice thing that you can do is just go onto YouTube and search up the technique. There's a bunch of different videos on YouTube that shows you how to perform a lot of the physiotherapy techniques, so you can always go there and have a look and see how they do it, and then you actually do it on your model as you're watching the video. So that way you can practice seeing what they're doing on the video, and then you just replicate it on your model. So yeah, YouTube is really super helpful when it comes to practicals, just to remember some of the things that you may have forgotten. The next thing that you want to do is that you want to walk up and down or pace around your room and repeat what you're going to say during your practical. So especially at the beginning when you're doing your whole introduction thing, you're going to do your introduction, right? Where you introduce yourself, say you're going to say your name, you're going to say you're a first year, second year physiotherapy student, and then you're going to go over and maybe ask them their name or whatever, and then you're going to ask for consent. Okay, that is super important that you ask for consent. After you ask for your consent, then you're going to go ahead and talk about your precautions and your contraindications. That is the basic structure of the beginning of a practical exam. The greetings, right? The consent, the precautions, and the contraindications. So now what you can do to prepare for that is that you go over what exactly you want to say. So for me, I would say something like, good day, my name is Benedicte I'm a first year, second year physiotherapy student, and I'm going to be seeing you today. Are you okay with me treating you today? That's asking for consent, and then they would say yes, and then you'd continue with that. And then you'd be like, okay ma'am, so before we get started with what we're going to be doing today, I just have to go over a couple of precautions and contraindications. I just want to make sure that you don't have any diabetes, you don't have any, what, I'm just making up things now, but yeah, you look for whatever precautions and contraindications you're screening for. That is like how I used to do it when I was in first year, second year. So you're going to go over what you want to say, and when you do that, it just makes you feel much more confident. It makes you feel like you know what you're doing. It makes you feel like you know what's going on. So just have that set down and have that written somewhere or memorized or something, so that you know exactly what to do at the beginning. So even if you've read the question and you're kind of confused or don't even know where to start, just do your whole greetings, your introduction and whatnot, and as you're talking, maybe you're in your mind, you're thinking about, okay, what am I actually going to do for this treatment? What am I going to do here? After you've done all of your greetings, you've asked your consent, you've done your precautions and your contraindications, you're going to make sure that throughout your treatments or your assessment, whatever you're doing, you have to make sure that you're telling the patient what is going on. This is not only, to help the patient know what you're doing, but also the examiner, because when they're marking you, you're not going to be talking to them, you're going to be talking to your patient. So if you're keeping quiet and they don't know what you're doing, then they can't mark you, you get. So you need to make sure that you're saying out loud what you're doing, so they can mark you on those actual things that you're saying. And I say this because this comes in really handy, especially when you get to third year. They actually mark you on your communication with the patient, how you interact with the patient, and you explaining to them what you're doing, why you're doing it, and all that kind of stuff. So get used to doing that when you're doing your practicals. If you're going to start measuring arm and be like, okay, I'm just going to move your arm like this, I'm going to use this instrument just to measure blah 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 blah. But also, because you have 5 minutes, I wouldn't suggest you obviously take too long. Maybe explain as you're doing. Don't stand there and be like, okay, I'm going to measure arm, I'm going to do this, I'm going to do this, I'm going to do this. Explain as you're doing it, because you only have 5 minutes to do everything. So as you're moving the arm, measuring arm, okay, I'm going to move your arm and I'm going to do it like this, I'm going to do it like this, and you do everything at the same time. Time management is super important, because those 5 minutes can honestly just disappear if you don't manage your time well. And that leads me to my next point, which is going to be time management. The only way you can ace time management is by practicing. And when you practice, you're going to practice your Ospe. So you're going to practice past Ospe sheets and papers. I know that the lecturers give you those example Ospe thingamajiggies. Yeah, you're going to use those. So you're going to be under the Ospe setting, like how it's going to be in the test or the exam. So you're going to have your model, you're going to put a 5-minute timer on your phone, and you're going to make sure that you do everything that you need to do within those 5 minutes. If you're not able to do in 5 minutes, you're going to practice again and make sure that everything is done within 5 minutes, and that's how you're going to make sure that you can manage your time well. Or you can just go into the test or exam with a watch, or use your phone as a timer as well. It can help too, but you just want to make sure you don't run out of time. Last advice that I could think of is that you want to pack all your things and pack your bag the night before your test or your exam, and that is just going to help to reduce the stress that you're feeling. So when you wake up in the morning, you have everything set to go, all of your tools and everything is inside your bag. You can just get dressed and get up and get ready to go to your Ospe without having any other stuff to worry about. So definitely I would advise, finish all your study the night before, get a good night's rest, pack everything, and wake up in the morning ready to take on the Ospe practicals. So that's all of like the main preparation information that I have for you that I can think of. If there's anything else that you can think of that could possibly help somebody else, please do feel free to leave it in the comment section. Some other random tips that I could give you would be also that when you're doing your Ospe, remember to always check your unaffected side first. That is something I always struggled with. I'd always forget. Check your unaffected side first and then go onto your affected side. Another thing that I would say is don't forget your precaution and your contraindication, because that is a sub-minimum. Oh, your other sub minimum is make sure that you are, especially when it comes to cardio, make sure that you abide by what they call the infection control principles, because if you don't, then you will just get like a 40%. So your infection control principles in cardio would be like, when they cough, make sure that they face the other direction. I can't remember the other infection control principles, but yeah, those, go over those infection control principles, because nobody wants a sub minimum, honestly. Some personal advice that I would give is that you should try and enjoy your first year and second year as much as possible, because third year is honestly just the ghetto. So definitely when it comes to Ospes, try to ace them when you can, because third year, like, the Ospes are just, not even the Ospes, like the practicals are worse. So if you're able to ace these small exams, then when you come to the bigger exam, it will be a lot easier for you. So I know the workload seems like it's a lot, and I struggled when I was back then, but if you just make sure you go through your work, make sure you practice, a lot of emphasis on practicing when it comes to practicals. If you stick to that, then I'm sure you'll do really well. But don't feel demotivated, don't feel like you can't make it through. Just remember that if other people were able to make it through, you're able to make it through. So just make sure you keep at it. If you're struggling and you can't figure something out, ask for help, ask your lecturers, ask people around you, go to the internet, just try and make sure that you're able to get the help that you need. I really hope that you're able to catch everything that was said during this video, because I felt like I was talking so fast, and that's just because I'm about to lose daylight, so I had to go through everything and make sure that I got this video out when I wanted to get it out. And that's all I'm gonna have for today, guys. I really hope that you enjoyed today's video. Please do give this a thumbs up. Please also do subscribe if you have not subscribed yet, and please do leave in the comment section if there's anything else you'd like me to make a video on. Also, if there's anything that I missed in today's video, please also do write it down in the comment section so that you can help maybe somebody else who could benefit from that. And I'll see you all in my next video. Bye.